www.healthcmi.com. Acupuncture Continuing Education Online. Today we'll be reading a sample of PID and Chinese Medicine Part 1. This course is worth 6 California CEUs, 5 NCCAOM National PDA CEUs, 5 Florida General Credit Hours CEs, 6 Texas CAEs, which are 3.75 General and 2.25 Herbal, and 6 CTCMA BC Credit Hours. This covers the United States and Canada with all of these certifications. All right, let's get right into the course material. PID in Western Medicine. Pelvic inflammatory disease, PID, is the inflammation of the pelvic organs and/or connective tissues, usually caused by an infection. The infection may involve a single organism or may be polymicrobial. PID includes disorders such as cervicitis, cervical inflammation, endometritis, uterine inflammation, salpingitis, fallopian tube inflammation, oophoritis, ovarian inflammation, and inflammation or infection of either or both of the broad ligaments, lateral ligaments composed of peritoneum passing from the sides of the uterus to the walls of the pelvis. General symptoms are abdominal pain and vaginal discharge. Physical exam is notable for cervical motion tenderness. Acute PID. Acute PID symptoms include lower abdominal pain, often with rebound pain, fever, cervical motion tenderness, lower abdominal tenderness upon palpation, leukorrhea marked by copious, purulent discharge, and nausea. An elevated white blood cell and neutrophil count is usually present. Abscesses may develop in the acute or subacute stages that are commonly treated with antibiotics or surgical procedures to drain or remove the affected areas. General peritonitis may occur due to the spread of exudate to the pelvic perineum. This may be accompanied by nausea and vomiting. In severe cases, endotoxemia and shock may occur. Acute PID presenting with a palpable pelvic mass indicates a possible tubo-ovarian abscess, TOA, or hydrosalpinx, the accumulation of serous fluid in the fallopian tube. Approximately 20 to 30% of cases of PID with tubo-ovarian abscesses are afebrile, and many of these cases present with a normal white blood cell count, thus making TOAs difficult to diagnose. Diagnosis for these complications using laparoscopy and operation using a laparoscope is widely considered definitive, and ultrasonography is also employed. Surgery is required in the case of a ruptured abscess to prevent septic shock. Chronic PID. Chronic PID symptoms include chronic lower abdominal pain or distension and tenderness upon palpation, leukorrhea, painful intercourse, menstrual irregularities including dysmenorrhea and prolonged menstrual bleeding, sterility, and lower abdominal masses. Lumbosacral pain exacerbated by the menstrual period or sexual intercourse is present in some cases. Etiology. PID is often the result of an ascending intravaginal infection transmitted by intercourse or an IUD, intrauterine device. IUD-related PID is often unilateral. PID may also occur after childbirth, vaginal surgery, or an abortion. Gonorrhea and chlamydia commonly cause PID, but other microorganisms may be responsible. Many types of bacteria, viruses, mycoplasms, parasitic microorganisms of the genus Mycoplasma. Other causes of PID include tuberculosis, actinomycosis, schistosomiasis, leprosy, oxyuriasis, and sarcoidosis. Differentiation of acute PID from acute appendicitis and ectopic pregnancy. Acute PID often mimics acute appendicitis and ectopic pregnancy. Cultures and smear from the cervical, urethra, and rectal areas may help in identifying the microorganisms associated with PID. Appendicitis is often differentiated by initial pain around the umbilicus or upper abdomen, then moving to the lower right abdomen with accompanying vomiting, nausea, and other digestive symptoms. Rebound pain at McBurney's point, a point on the abdominal wall that lies between the navel and the right anterior superior iliac spine, is often present with acute appendicitis and helps to differentiate it from PID. Ectopic pregnancy is differentiated by a positive pregnancy test, irregular vaginal bleeding, and violent pain of the lower abdomen that usually starts on one side but may spread to the other as well. Hospitalization is required for these surgical emergencies. PID facts. In the United States, PID rate is highest in sexually active women under the age of 25. PID can lead to the destruction of tissue that can result in sterility. PID may cause scarring of the reproductive organs, especially the fallopian tubes, which can lead to ectopic pregnancy. The Center for Disease Control and Prevention, CDC, notes that in the USA, annually more than 1 million women experience an episode of PID. Over 100,000 women become infertile as a result, and more than 150 women die from PID or its complications. The CDC notes that a large proportion of ectopic pregnancies are due to PID-related complications. The CDC also notes that while lower abdominal pain and other symptoms are common, chlamydial infection-related PID can be asymptomatic. I hope you found that course material very interesting. This is a written course, so when you go to www.healthcmi.com and purchase the course with a credit card, you download this ebook. It can be read on any computer, Mac or PC, Linux. You can print it. You can search it. It has a search function, so it's great in the clinic. And it lists a lot of herbal formulas, acupuncture techniques for the treatment of acute and chronic PID. Further topics in this course include important factors of susceptibility to PID, treatment and prevention, Chinese medicine differential diagnosis, and several formulas. There's also a Part 2 course with much more information. To learn more, visit www.healthcmi.com. Thank you for listening.